Hello, my name is Aurélien Bernheim. I'm a PhD student of Benjamin Boutrel, and we are working in the Center for Psychiatric Neuroscience at the Lausanne University Hospital. Today, I am pleased to speak about a review article that we recently published in Frontiers in Neuropharmacology, which is entitled Controversies about the Enhanced Vulnerability of the Adolescent Brain to Develop Addiction. The aim of this publication was to summarize the current knowledge on adolescent vulnerability to drug abuse and how it is mirrored in rodents. It is well known that drug abuse usually starts during adolescence, and the sooner is the beginning of drug intake, the bigger are the chances to develop drug addiction. Therefore, understanding what drives the enhanced attractiveness for drugs in adolescence may help to improve preventive strategies in this particular vulnerable population. Adolescence is a period of profound physical, psychological, and, for interest, neurobiological changes. Many imaging studies confirm the role of the mesocortical limbic system to drive adolescents' behavior, especially concerning the prefrontal cortex. Several factors have been associated with a higher risk to develop drug abuse, like an increased impulsivity or a lower ability to cope with stressful events. Only a few studies directly compared juvenile and adult rodents in behavioral aspects relevant to drug addiction. Some similarities have nonetheless been found, such as an increased impulsivities for delay reward in adolescent mice or an enhanced rewarding sensitivity to social interaction in adolescent rats. Regarding drugs effects, juvenile rodents have been proposed to display at the same time an enhanced attractiveness for the rewarding effect of drugs, together with a lower sensitivity to their aversive effects. A protocol classically used to measure the rewarding component of drugs is the conditioned place preference, in which juvenile rats display an enhanced preference for an environment associated with drug intake. Conversely, conditioned taste aversion measures to which extent drugs' aversive effects would decrease the consumption of a palatable solution after repeated pairings, and this decrease has been shown to be lower in juveniles compared to adult rodents. However, the consensus on juvenile rodents' vulnerability to drug abuse is not that clear. Many contradictory results between studies could be found, and some key features of drug addiction have not been extensively studied in this particular population. In addition, the meaning of these differences in sensitivity to drugs' effects might not obviously lead to an increased vulnerability to drug consumption. For example, the enhanced sensitivity to the rewarding effect of drugs might lead to a decreased consumption of these drugs to maintain a satisfying rewarding threshold. On the other hand, since aversive drugs effects have been proposed to drive the transition from occasional to compulsive drug use, a lower sensitivity to these aversive effects could protect juvenile rodents from drug abuse. Altogether, despite some elements of vulnerability in juvenile rodents, some key elements to confirm this vulnerability are still missing. In our lab, we have accumulated several preliminary results confirming that this vulnerability is highly task-specific. When assessing some key features of drug addiction, both juvenile and adult rodents tend to behave in a similar fashion. However, some specific traits in juvenile rats, for example related to impulsivity or resistance to punishment, might predict later trajectories in drug abuse behaviors. So, more studies will be necessary to understand the causal influence between these behaviors and drug abuse vulnerability, as well as the neurobiological substrates underlying this vulnerability. I hope that this article would be helpful to understand some specificities of your teenagers, and I thank you for your attention.